Everybody is speaking about ambulance, but everybody sees ambulance is not here. But I'm very sure ambulance will find its way in a few days here. I'm not a man for words. I'm not a man who do a lot of speeches. I cannot do very well, but my wife will say some words.
Ako mo dala biang jang biolo ko ka ambulance kudo ning ka welcome. Ako mo ma ambulance jijang. Ako bara ba pala mo yo ko mo kana jikilate ambulance bijanna do kombole. We fenne to pro kan ronno pare da drong kili dentang ko raga ambulance je la janne. Adun fana si do man ding ka fuje ka tan ni ko ambulance ya ñoo man sodo Gambia jam folo. Ako bulola.
Good evening, everybody. I'm Anna. This here next to me is my husband, Steph. Next to us is Seni Gamsa, member of our group, and Bamadi Bayo from Karataba, also member of our group. Steph and me, we already come 13 years to the Gambia. Since we came here, we started to do projects. Why we do those projects? That is to help people to have a more comfortable life.
Akaba de kondon nabi minong anati akema wala nyinti Steph aning ila terima bala nyinti ka ho meseni tamfa apana mbe boko wala projet go nyin konole ina be steri nyokan ne fana ninde bango bama di bayo modol londol mallon so aka kontan da bakele pour kaytan dalla ko biila na jang e dalilo mum menti bina kan jan sa sanjitan ni sabasile kana Gambia jang so ira demaro fanan ya akuma yara bakele pour ye molla demar ko ye minni kaytan kala fi kawle kila.
Our help is from in the beginning up country and not in Congo. That has a reason. Not because we like to sit in the car so much, but we find in Combo is already more help than here. But it's very important to say we do this work not alone. When we search money in Belgium or we organize a program in Belgium, we have many people who work with us. And also here in the Gambia, we can count on very good staff. And the most important members of our group here, like I said before, is Seni and Bamadi.
Ako ibadan lalla ko italando ko ganyaming. Yajele ko kuming kamol ba ma ko meli along ko bataring. Iko bari na dela do ko nyinjibe yaje ko komote. Komite dula de dame along ko simol ma ko no. Amange ko kuming ka kombo kana jang ikala file kuming ka simo do ko no wala kana jang bo manke la dalilo ti bar kombo di mar jamal le bebu. Dula jamal ne loptan jamal je kombo hani mo sa sara je ga bala la sama kombo. Itel na ga je ko ndella de maru woto alinga bondi jang na samba bolon kono wala sulata because kabrina ta jela na folo e tamo ke dula je mul ka batana musul la batatan inaga iko sain dalla de maru anin na kapo bana de la kombole adunga manke dal jammanti melbe do ko la do bije o manna ono bari ni be ka do ko jere twab do ti ayila jang mil ala ngo be lori la jang ke ma koy kade wala ko men be ilafta e sonoya aka sonoya wolong mol kono mel bije wolon seni tam faade membe siri nganin te bamadi so ndelle ni nata nyola jambe bana.
1 year ago, Kausu Diary, who is living in our village in Belgium, asked us when we came from Karantama to visit also Kunting. So we did. We were very happy about the work of the BBC here in Kunting. We had directly a very good feeling.
Ako ila do ko kabri mo ranum Belgium ini mo benday ka me Kausu Diary mo yalon ka mo Kunting dingleti so ko ngamo ya be do ko kendo men nan na dundo kan ay ko nya fa bagale ngala do ko moy karanta ba komin ka koñi sonandi domandin dronka tarika domandin fo italo molti fana mele alon ko itale karanda bal lotano ni ya ede maje yela bumul ulu bumda de ku jamale keje nyoturra masinga manke ko janno la dogu fo kabrin kawsu dari yo mo ya ko fana be kontan la bage nal na ta Gambia le furan na wulu sa de do ikaba me kunting anata e kunting nyinin ka dame mo ko nal ni nyilta ta be je tan dilalla so ilina da bewo nyale poina da fura kunting adu ni mola dem folo kunting jang di kontanta batele so kontano kan ya tan dila ko be murula nan kunting ne wala keta biti bi murula nan.
And because our very good feeling about the working of the VDC, we are very, very happy today that we have finally the ambulance. This afternoon in the car we got a phone call, the technical problem is solved. So I think next week or the week after, the ambulance will arrive in a good condition of health. To bring this ambulance to Kunting, it was not easy. It asked lots of energy of the people in Belgium, for Steve and me, to find the money.
Ako fanang ikontanda bage kabrina rajang inen kunting kol benda kunting kol yela kol fele problem ol fele wala ko la nyen dula to jang urni si je develop no anik ambulance sula dala bagele kado wad dol ni muso tunge aboy suto wato wadila aka kole abagele pour ka futandi loptano do ila da ambulance nyin ka soto Belgium fana kole ada bagela manke kuti me alon ko so no yata because mo jamal le je mele alon ko yemuta yema ko fe ambulance ni soto sa ambulance ni felenti sa entanga be kombole abe tembo mendo ako titan tanya do lokumo komita fono la lummene le murula na barata hani mela fo be murula na kana ambulance ni na fale jam se bulo ko siwala.
Also in the port in Banjul we heard it was not easy to get the car out of the port. Thanks to Seni, and I think Usman is a witness of this all. The car is finally at our place. So we thank you very, very much for the welcome. And if I see so many happy people, it gives us courage to go on. Thank you very much, everybody. Thank you.
Akala ko kumpa dula abemetan dilalla ko ambulance ning anata Gambia le kabondi poro do lom komi anati bala silolla kabondi ba poro do je akole ata bakele ilani mo men bijang dogula ga fa seni dam fa kata bakele ko sa bada jamale ki je pour kanim bondino ako ila kesi ke no sedo tele mama akata ya sede ala kabring seni be nin dogo kala pour kabondi nang poro do akole ata bakele. So ako kamala ikontanta bagele bu ambulance nimbe suwo kono iko momo konton na aliyo kom janyame ifurana janga bedada bagele mo kontantale ay ton fanam kontantale iko mo be tankla wa fala ali ala barakatati.
Assalamu alaikum ndere dum seni dapat be puti bol be kontonna be jeyna alla aliye wel ko nyami ayen del kontani baki del be mo mandi kolleti be mo misin molleti amanke te wuluta jarale wala te wuluta kiyande ko manke bagi de hani del be mo misin molleti ana tara pa be manke misin mode bari be mo hadamadi molleti so hadamadi on be bota mo kilina balan del be bota be ba adamani be ba hawale bala. So senye tandi ko nyomba di nula nyom kanu yela pinyona yenula onula ja bediata kambiona ya bedian yenula onda ja tinyata kambe bali ale ya tinya Kunting de nyepurti muda bulfulo la bak Kunting alfa linye tentu baki nye jayi mingeda almambadi aning alkalo aning dala bala satella aning fama panabi jang bayo limboda karanta batendala so nyemo be konton ni Kunting ko fanal jayi ila katola ni yaje bi intervena fu dala Kunting jam tambita sate jamalena tambita sate jamalan sitano wo sate beto bari manni ko nyaanya ko ku sababu bala so tella fudo jang Kunting sate kono a sababu ko sudari le so wo sababu kama alama Kunting fonni kebe ke ni sababu sifati Kunting banko kan ani Gambia banko mumela bela so mbedu ala Kunting kol fanale alfa lam famal bari on ko dol dokol ko ala sembe so simani jara kenya nyin kayra silo minata fo ala sake nyi kayra sila wilikili momo hammobe jang nyin ke baro la kake alune masi na lu sida ala ba fondi lele yake hada mari on kukili be dunya balo duniyo non batati je ala yenda le nyon dema bar ala manda nyon ki hadi nyakata nyon muta nyakata nyefa nyonna dunia balo mu nyineti amanke nyom buteti amanke nyom ko makumati ale nati dunia kono le nyenna nyantol tamandi so woto nimbo nyantol tamandi kan nyela fi nyonna nyon kanu woto mo kayro sabatindi la bankoka ani banko bantala sate mu melabe okay tel nala janke Kunting kol nyekol kidimandi jos ambulance o nyi kabrin ala na bayta Kunting kontanta bari na kontano murukta ko mabati tanto munen na kontano murundi koma nter nyalom bolon ko man ko le haramadi ya min bebulo ni data or jikindi fenna o few man na futa ina man na nyonna anata te fo malu bake anata step malo anata ana malu anata ba madi bayo ba malu bari ko min jiko nyimbe je hanibi ambulance o kuntinne tam ni ala sonda ala technical problem o nyi a soltale den furata ke bonan ke tembeta jara jabine alo ala kol dunta fita en ko la ko nyi ko seni ambulance o nyi paredar so nada fay so mbagela nyaadile so masata no la ko hani so mamuga do koke nyabula monde ni ala sonda so wotu mando ba don fana be jama be danila al sal hako go ndinye na ambulance on nanati baliala amake haketi bari fana antel saje no ko nyal hakedani doron ko min nyamaje nyame kaje natalo to akumaya da bari ke fionje face to face mole kumaya ta so fana be kafo dani la duala min keda anani safety ani bamadi bayo ani sendamfa al se duantel fanale fo ala se nyong jama nyi nyande del ni tema kadum bi ninte ko hani bamadi bayo ko hani atekela ninte ko seni damfa ko hani bamadi ko hani atekela ni step ko ha ana ko hani atekela ni step ko yes ana ko hani atekela so nsedua fo ala sen naka fo nyin ala sen so kambeona nsedua fo ala sen tanka jawo la masibo kadu jawo ka fo warta nyanya na dum tal kono do asati nya so fo ala sen tankoma ntenyina mun nangani yoti ni ayatara Kunting kol ke da bansan lafa janni sanyi fula nya dondo bansan ko le nanan Kunting nina mun tela ngani yoti andon safo ko de nina mun nangani yoti bansa yebo nanje yana Kunting tumando bado nisi mani jake ndiye bije telimano bari alayano ni alayano wodon nake bal fanal mil besiri njam mi ketam fama nyolti mama nyolti wallahi wala duwa ala bo jabirale so ni aje Kunting binyi ko tambitana Kunting ko la alfaya ay bunda fa ida duwaye banko muta ay sate mol muta alakata telephone linkeli nyena alfa lu batu bake tanana alfa la ko mosoki jos ni dinwo dindiniaje duta mistake kono ni ko ma jube bake iman son alfa lema ni alfa la yamarota dorom batati je so nyaatuwa fanalla alfa almale min nyaato so ma ko yo fana bunda fele nyimin nati na le min keta la raunti la alta putandino janya kuma do fusiro nyina ko do min yalon isira monyin nimi yaje isamela siran kenzon siran kenzente ni ayatara ko sasa do nyimbe hospital oto so atemin nola yo ta patandi ko mi molti rawnina hani ise fanna fano wala yesi bari ise fanna fanola ku jamala kantu ne atrete siwe problem on soni te jonko do nola so namol men gada ananiste bi nata wo ko fana mira kabring itella village committee yenyi tan ko nyi sira on nyi lafta dilale itelle hakil bulande ko ko hani nyi beti ada Gambia le sa samba kunting nyata mol ma koy so bar sira on nyi fele ni ayata ko mole sa sa date sino la sira on nyi mudu solet ise sijulolom bang ya dunda kodo mose sino aya famuna fala so nyina musira on nyina na fali sirando nyi fana fele koma so nyindo mo komi mi yalon ko asasada tamo ya batandi asafan sel bentu ya nyinna ay tamo fo ala se tamo soni andai nyinna ta wole kam anilla lan fula fana be jang so fana nata bawo silo lo man jamfa bari nyindu wa ko albe nyom jama sugla nalta ta jibe ko biya mo man jamfa parce arsuda durado aleta optalo to fo science albe nyi sira on talla jede bang alta jela ando nyenyin gale ko sampulo le ko kuntin ko minala le ko kuntin ko yo dala nyami alsa kada ale do akabo anani stefge ani bamadi ani seni dampa ko ala sen nisade mol beso kambeona ko kuntin fonni ken fana ala sene me bema ani kawsu dari ani nye kono ke do fana to moy ka pay ko lamin ko sawo konate so alse do tel fanale ido ko ini ko do min bijam ko alse ni be so sabu ni mala momo hammo be ke baraken do ke da sade do fo ala sake momo hammo we be nyin ke baraken do kan alama ala sake ni hôpital o nyin na folo daten nin ala natalo be fon fem bulisa natale sanji kili sanji fula ko mando ite nyin na natalo jela so ni se kale sampuloti al sanatale wona salo ategale sampulo de konna optalo nyin tarta non tenne barbi ni optalo ten nyindi so ade kelele so se albe dani tuwala ale tuwa bankoye ani kunti dala bala satel mumela be fo ala se nyin nemo jidi sate o sate be jang ala kana dandi kunti non nyimbe kala kunti e sampulo ledi ando nyimbe kala dala sate be sampulo ledi bedo ko kala fo kunti ko la tala nyami al senso tuwala ani champion sate la kambeon ni aje podo na da sate kono amanke mo firi na kegende ya di sate kono sate la kambeon ya sabu so wo kambeon nyimbe duwala fo ala sa kambeon nyimbe nal tema alama ale kambeon yirwa alama mari alama kuntin ko so sabu nyimala momo na la ta kayro la jang ala sa nya kilinde jang ni momo la ta masi bo la tilina kuntin ala sa ko la dindi janna ando ala bo kala le jos alfal bi janna mi dalon ko ni e bulo la man satalla abe la duwa talal so almale mi alla dimbal nyato almale mi al koma almale nal beso si mani jada kendani pirode la banyinya al senso duwala anana ke mako ala senso sabu nyimala ala se tanin na nya soni jos nyifyon ka sodo akunde ata baki ni boy ko nyin ko do sodo aman so wala na nyindo mo molti medialo nyeduwe bake ida tanin na se sonia ko ala se so jada kende yala kanto nyillo moti medialo ko ale yalon kila yalon yilla mutubabo di medialo ko ila tama ko do Afrika tubabo bi je million le be bulu bari image bari nyil ko itele be fonola kompola itele be mindo tulaje bari itel binala le Afrika no ma ko fo ya jada dami so ale so kulola ale duwe bake jos nte tata jiri saba nte Belgium mansino be kodo nyini tan pour que na ko kunti sponsora so nyoje ko tonya nyilo mo hada madi ulti miliaron ko alhamdulillah alma ala niso jos ye ko min ke West Africa jan ma ko tubabol mi jamil bakela baraman siya ni tubabol nata jama bi je miliale ma interest Africa la wol keta si Coco Ozone Hotel Senegambia Hotel wol mammo la time soto wol kenale do ron kenna dindi ulti nyake minti faye bari nyel boy gon den manke tubabol de milke minti fay dindi ole jos del nyaaro ni minti fay dindi ole geti nyaare del minti fay la dindi ole del minti fay la sade mo legi sade kono se sade mo kono gol dema boy ko nuwo be keri ala ba kelale so nyelo mo molti milialon ko ikendiyata ando ilafta jamala ko kelimbe la foto ko ni nadun deni tema akoleyata adiyata tonya ko ye tonya fo edoro ye kam fa banne bawo mo siata diamula siata mbe mo be numbara la nsa fo ko ala albe ya baraka ndelom seni dampati ngaf ñoma ani bama di bayo ibeja yo nyifana iko kadi kunting football la miliyalan ko ana la timo bijele ani Stefan bida la timo bije so e ko momo la timo ana la timo folo sina bawo musole folo ke sa ni muso bona je gena ke oso ko lumi na jani mo bongi Kadri Usman be sunni ko kadri somanda ko suto talanta aman sunni aben noma wonun defoni Usman ke lu tawre de nyamo dal ci ko kunti go bala fatay ay ndunda ko ko na sa ko na do man do ma alama so ne yala ko ko ndunda be ni patati je do ron ko man do tigi tigi alse do afana na la committee mo fo ala sa ma de jana kenya aya kata bake anara timbal mo mela be anisa de mo mela be do be do ala mo be alama abarka bake damsa funding chole mete komje funding chole jabe babi yekadua nike tambi bake kambele mane ko nen kampo benda tempio ko mahali bi fundo benda barka bake ale sababu akumma ka bakelo ngafo moto kono dari nyala barmbu kala ko kamo fala ko do fa fa nyala bak kabu modul kado jayrolo jayrolo ko ya moy bari harmadi ya jay nyaadi kolo ado nyaata la ba wala ka nyala wulolo kaw ko dari mbe ala ko ni ka ko dulo aga dami mbe ala ko di ni malo akarata akufata ay hammo sodo asobeata ay naliyo ko ko do ka do wakati ning atar ko le dono kunna di ko de ta na ga kausudari wala mo ko sumba fati nyandara na mbembu la ma sakala dinna alfa kemo madwa kausi ko ala ta sumayende ay sen name de yoke asiyone de silam la c'est pas bon manda harap jantan ni eso okay Assalamu alaikum warahmatullahi salmini kunting ko e dala sare de akabar be ko to kunting ko anen kunting dala sare nafra ka man sene awarunga apra la doman ako ade kunting ko na ina alkalo akada albago ko na kakala doman ako abe BDC chama ro kodona ako abe kausdari kodona ako yedo ko be kete do ko kele ako ni adara banku dube kanyireke tay hebi hunde dum siftora ako hanna da ina da yefen so do yo iyamira ngal man jang kontru dal dika kanya mi mulbe kata kala tari ako a wode ko ko kelo e mari yo reke ako janga bake abi ala ko mode jamba bake ako nim ila nim mo banko bere de mati ako wala akemi ala ko mode jamba lora ako sofala kuda ako tubamodi ako abar kondona ako ina nyomi ako bebuala ako ku atel faso sisi apa program ako nimana kutiye de ako Gambia be ina dawle ako wala kenda ako nimana kutiye ako bebuala ako abe tindo mo kotona ako salama ni sofo ko makamu ma papu den bajao okay wali na moy ali na moy be banko se ko kontona be alkalo kontona ni sado albaze be alma ko kontona ni sekunda be den na midisi chama ko kontona koni ko balbe kontona be kanyale guru ko kontona na tananjalol kontonna na tambar buna soto kalai bora adin aran buna na tuwa mo tambar buna jento ana istiman de kontonna mo de jampano na bage ake bunda makam imu busra lune kaje ko ninyom ko kuma aina sa na bakota aina kunting sa do ko ya ba ngoro be ko ko ay mo ma ya mo ni kunting dar sa do bono dar ki sa do lam nyani banko kam adun duwa jari sa do lam nyani banko kam duwa jaro bi mboti lol ko do dana tendina ba jera ko ci nyaaru ka ko na kam no may me fana yidandi ko ngala plano ni ngala plano ni korosi baake jannin sanji kilin nyimbina kala taale ko de ngamra nyanta bulo ko sawra baake kanta yelo nyanta ko mama ko anu baado ko ko sura wada baake ko sa itandi la ko jannin sanji kilin ni de plano nga koros baake abe kala taare ba dum de laare ngala ko abe kala le debe danke nera ko abe kala ko gamon be kawsu dari kon don nantero ay teriya da fa o nyato nya tero le mat ay tero na de Gambia ay tero na de Sami ay tero na de Nyani ay tero na de Kunti tero ko ne mati mate lamba jela ana kap nyoma la min konate ani Kunti dun me bebe wulana ani Nyani dun me bebe wulana ani Sami dun me bebe wulana be danila si misali kawsu dari ani damen ko na de nyosi falla ni si falli si fero teke akata kanati mulu satol ga kanati mulu banko ka nyine mu banko di kende ya nyamu banko di fam le banko di kendo mbete de ko sukuda do bano to yala ka pasakunda to yala den na don bismillah da babule ya baraka do bano mo ki nan de jam so manda nari bijande para atara mun den do mana be magadi abulo mo da wato de da amanna lu ton badno bali ko sinyi dan da do hakino be jam
to welcome you to the Minister of Health and Social Welfare. As you know, health is everybody's business in the Gambia. You've been to a remote setting, Kunting, and you've realized, the problems that we are facing as a country and as a ministry. And I must say that in no small measure, that the support you give into the ministry will go a long way in, alleviating unnecessary, suffering, that is afflicting most of the people in that area. We are really very pleased, because Kunting, I can see, is basically a hard-to-reach area, and given the fact that the outreach services comes twice a month, as he has said, it's something that cannot actually sufficiently provide health services to all the antenatal mothers, as well as children and other women that are in the place. So the provision of an ambulance, to the community will go a long way. And I must say, I am very happy for them, and and to you, of course, for providing that. It's unfortunate the minister is not around. He has gone on a presidential tour. He's in the farmer's store. So the president has crossed over to the North Bank. That is the side where you are. Kunting is on the North Bank. The Gambia is divided into two equal sides by the river Gambia, and along this river Gambia you have islands along the way. So Kunting is on the North Bank, but in Sierra. So he has gone to the North Bank region actually, and they will go on a country tour. So he's not around, but he was telling me that he actually wanted to come here and tell the minister that through your help and support we are able to secure this ambulance, and we want to say thank you. The minister is not here, but I am here on behalf of the minister, and I want to say thank you to you people for providing this ambulance, which of course we are very grateful for. We currently have issues with our health service delivery, basically not only because of health facilities and lack of doctors in these settings, but actually because of transporting women from hard-to-reach areas, partly because of lack of ambulances, bad rooms, healthcare affairs. So basically this is very good, and we want to say thank you very much. Yes, I will go down with you and see the ambulance. Yes, and then I will report this to the minister when he comes. I was also on the phone with the Secretary General of the Red Cross, She told me, yes, he told me yesterday about this. When I went home, but I was sleeping, I was tired, you know, because, you know, I close at 6, so it's a bit hectic. So when I go, I eat and rest for an hour. So what she told me, but I did not get the gist, you know, but he told me in a language that my father speaks. So I understand very well. Yes, I understand very well. So thank you very much. Thank you very, very much. Yes. So I just don't know the name of your philanthropic group.
I will explain. Yes. Anne and me, we come already 13 years to the Gambia.
13 years?
Yes.
Very good.
From in the beginning, we saw, yes, okay, there's a lake or a lot of things here. So we said, okay, we will start to do some little projects in the Gambia. To try to collect money in Belgium by our friends or to organize something. And when we have 2,000 euro, for example, we want to do some little projects here, but we will not give the money like this. We will do a project.
Because if you give the money, you encourage corruption.
Yeah,
they will take it as their own.
We want to avoid like this. Yeah? So we went already many years to Karantaba because that's in the
neighborhood. Karantaba, yes.
Yeah.
I know.
It's also up country there.
I know.
And we help there also already in the clinic there. There's also a clinic with the solars and the water facilities. Yeah. Also the women for the women garden. But we pass always Kunting. And one of our members in Gambia, because Seni Namfa is working for us here, we do all voluntary. He also, but also Bamali Sevayo, we have relatives in Kunting. And by coincidence, a Gambian man lives in our village, in Belgium, in Tervuren. He works on the embassy, and he's Kausu Dari. He's from that village. He said, but you pass always my village. You pass always my village. Why you don't enter in my village to see also my village? Because we need also. He said, okay, next time we will visit your village when we come from Karantama. That's the reason last year in November, we came there, and then the VDC committee explained their needs, and they said the main problem is, the biggest problem is the transport to the clinic in Bansan. Because we have a health center here, it's very little, 2 times a month, and nurse comes, no medicines, nothing, so the most of the people has to go to Bansan, but we have no transport to Bansan. So we said, okay, we will try to find money for that. First, we were thinking to buy a car here, but we did not find a good one, so we buy a car in Belgium. First, we organize few things to get money. Then we buy a car in Belgium, and then we transport with container from Belgium to here. And a few weeks ago, the ambulance arrived here, and then Zeni take care about it to take it off the port. So, and now tomorrow we go to Kunting to give the ambulance to the Alcalo and the VDC.
And there was a small technical problem.
Yes, there was also a small technical problem, but that is arranged.
Yeah, that is now arranged. So we went on the weekend to celebrate all this in Kunting. It was very, very nice, but we didn't have the ambulance. But now it's all okay, and now they have to go once again to bring the car.
Yes.
And the name of our group in Belgium, we have a name, because you asked the name, it's Dimbalma for Gambia.
Dimbalma for Gambia.
Dimbalma. Okay, it's Wolof.
Yes.
Wow, yes.
But we are Mandinkas.
Yes, we are Mandinkas.
Because we got, I think, a Mandinka name in the weekend.
What's your name?
In Belgium,
no Mandinka name.
Aminata. Aminata Dari. But in real, I'm Anna. Yeah.
Welcome, Aminata. Welcome. Welcome home. So we are very happy, and thanks for giving me a genesis of the whole thing. So we must say we are very pleased, and we hope you people continue on that philanthropic idea of trying to make money for Gambia. You know, because no amount of support is small. Whatever you give goes a long way in removing and alleviating unnecessary suffering. Basically, as you can see now, the ambulance services will be available, except that you have to work on other logistics like fuel, spare parts, maintenance. But all these things, you know, everything starts with a single step. So, but anyway, we're very, very happy about this. And I mean, I think RIT, work with the RIT. So just involve the regional health team. They are answerable to me. So we work together. So once I get to know this, when I go to Bansang, I will tell them, oh, one thing I had, they had an ambulance. So it's always very good to put me in the picture, you see. So I'm very happy about this.
And we do finally one big project a year, only one. And but we do three things. One big project, we send second-hand clothes that we divide, and then we help some sick people to buy their medicine. That's it. Yeah.
So you
when
help,
we go to the hospital,
you help sick people to buy their medicines.
Yes.
You give second-hand clothes, and the other one is
the big project for one in the village, like
for the committee.
Okay.
Yeah.
Okay.
Three things.
No, this is very good. This is very good because basically, you know, in the provinces, the healthcare system is robust and responsive, but the government supply system is a bit, you know, it's slow. So getting drugs across to other parts of the country is very difficult. Although we are trying to work on the logistics of making drugs available everywhere, but you can know the terrain, you know, getting to those places is very difficult. So, but we've been working on it, and we're trying to see how we can get essential drugs, you know, in those settings, you know, things like life-saving drugs, so they can be in those settings. We're trying to see how to equip the hospitals to a level that they don't need to refer, because basically we have a drop in maternal deaths, you know, and neonatal deaths, but all the same, we're still trying to cover up. Because basically, what we're trying to do, let me just. So basically, we're trying to see how we can put a community health nurse, a CHN, within every 3 kilometers. And we put an ambulance service every 25 kilometers. That is part of our restructuring of the primary health care. Exactly, and an operating theater every 50 kilometers. All these are part of our plans, but we need human resources to put doctors in these places. So we've recently spoke to the hospital that they have a checklist for doctors that graduate, that they are able to do cesarean sections before they graduate. So by the time they graduate, you pause them and they do the cesarean sections. So we don't have women dying because they have no place to give birth, or the doctor is incapable of doing that, or there is no functional theater. So we're trying to improve, but you know, government cannot do it alone. So that ambulance that has gone to that village in Kunting will go a long way in actually helping them, you know, deliver women to the clinics and health facilities on time for basic interventions. Okay, so we want to say this is very good.
Yes,
I think to add to the Mr. Steps what he said, they still have another project coming in few years or so to build infrastructure at the hospital, either a ward or so. It's also on their plan. Okay, why as of now the ambulance is with us, but you know they only give us the ambulance. All other arrangement pending within village development committee. That is their fueling, maintenance, and the drivers, you know,
salary.
So we're trying to appeal to the government through your office, whether the government can able to intervene.
Yes, we can do that. We can do that. Basically, what they need to do is to work with the RAT. Yeah. So we include that ambulance in our fleet and take care of the
That's what we need.
And to appoint a driver to it. So basically, we've been doing this over and over for most of the community clinics and for the community villages that endeavor to go the extra mile to provide themselves with ambulances. Because if you can see, the Gambia does not have any organized ambulance services. For instance, in your country, you have a number to call, and an ambulance comes and collects you in your house. Not in the Gambia. You have to go to a health facility that has to refer you to a hospital. So you just cannot go anywhere from your house by ambulance. The ambulance transfers you from a health facility to, yes. So basically, these are things the village development committee needs to work with the regional health team, and we are sure to help them with that.
I'm not sure we really need your help, because these people are ready to help the community and the surrounding. We have almost 8 villages who are benefiting from this project. So which means we really need the support of the Minister of Health.
No, you will have that.
Yeah.
You will have that. What are the problems? Say now that I mean Ariti kacha, I mean Baba Gale kacha. Bro, kanying ambulance kabulandi na flitu kono. So imagine like about fuel hotel government. But driver ni nela yale mi bajula. I think. Kala tule minister. Sila mo nyana kala problem. And abuka ke problem oti dula do to fam. And ni minister lo mo minister. Because na procedure la so.
And what is your idea about that? We were thinking also to continue in Kunting, for example. That is depend of the demand of the VDC, but for example, to start or to build a little place where a woman can deliver. For example,
yes.
When there is place in Kunting where a lady can deliver, she doesn't have to be transported.
Exactly.
Yeah?
No, but that depends on our policy, our primary healthcare policy. We will look and assess the place. If there is a need for a labor ward, we will try to see how we can get that done based on how we've restructured the PHC. But anyway, we will see because Alkata Mindole. Alkata Janjamburi.
Bansang wala mo Janjamburi wala kana Kunting.
No, Mindola Gana Sutiata.
Abe is almost the same. 11
So how many
kilometers?
How many kilometers?
11 kilometers. 11 kilometers. From Kunting to Makati 11. From Kunting to Bansang 11. Bansang, but Bansang is accessible. Because there is despite that, but it's more accessible.
No, good. No, I understand because bargaining and it was so, but we will look into this, but we cannot promise. Yes, we cannot promise. But sometimes we.
Okay. Come here, the Frank for that. With the Lafamaco Rocky, come here, Pro Nasaro Doji. Because come in the Race or Nila Faco, Lekata, and the Lula Minuto, and in Palaso Monyan Kaloje. No, now I got it. Okay. What he's trying to tell me is actually the project trying to expand. You want to go on an expansion project of trying to get a labor ward, trying to get an antenatal ward. We are fine with that. We have no issues with communities, coming up with their own initiatives of providing healthcare through a philanthropic group. So we actually concur and agree on whole terms with you. But basically, when you do that, you talk to the regional health team, and they'll give you supervision on how to build the labor ward, where to place it. Because it needs to be isolated from the main wards and other places. Yes, on how the toilets should be constructed to reduce the risk of infections and all those things. So basically, you talk to somebody who knows these structures. And we've done a lot in all these communities. If you look at this place, we have Jarol, it's just before Kalaji. They are working on an MOU with us. Yes, and basically we supervise on how these things need to be structured. So believe me, we support you 100% because you are doing things we cannot do for ourselves. Because basically my father taught me in Mandinka, never ask people for things you cannot do for yourself. Because if you cannot do anything for yourself, why do you have to go around asking people? So, because they are difficult for everybody else. So once somebody is going the extra mile doing it for you, you have to show appreciation for that. And no matter how small or how big, you have to say thank you. And that is what we are saying. Thank you very much. We are happy you are here, and we wish you all the very best. And we hope to work with you. And we hope you enjoy the Gambia. You've been here for 15 years. So you enjoy the Gambia. Thank you very much for coming.
Thank you also. I fanaya baraka. Jos hadama yung kay mo lombia amang kolya. Yung fanal welcome nyami wense wala. Kaya itande ufana itande telefona la ko ita fana mo kende.
Exactly.
Definitely. Thank you so much.
Thank you too. Thank you too. Thank you. So let's ambulance.
So, what is the name? Aminata?
Aminata.
I think maybe you need to. How do you carry patients here?
This now their question. They want to cut this, I think. They want to cut.
Yes, and put a bed sort of. Because pregnant women cannot sit, and very sick patients cannot sit. So maybe you look into that, but it's a good vehicle, really. It's a good vehicle.
No, I come in here for you to, I say, if these garage people can able to modify that one for us. Maybe it will be on one side.
We can talk with them.
Okay.
So just take it to Kunting,
okay.
And then we can talk with the regional health team.
Okay.
But basically, I think I think 164,000
It's a strong car.
And what is the make? What do you call this car?
Sayon.
Huh? Sayon. Is it C or S? I've never seen this.
So a strong one.
A strong one. She has a very strong accent. Yeah, so thank you so very much. Thank you very much. I appreciate it. Thank you. Nice to meet you too. Yeah, you have a Gambian name? What's your name? Come on. I will tell the minister, okay? Thank you very much. Thank you, Aminata. Yes. Silla Alabar. Hello. Hello. Hello.
Jani dalaka Jani dalaka Manuye bosili le fe Mfaye bosili le fe Ite dalaka nema sino yena Nkoroluye woluye nani fe Dalaka nema sino yena Mfaluye woluye bosili fe Dalaka nema sino yena Jani dalaka Jani dalaka Iba kani wama fila membebe niye Dole diye nindoye Kele na korosi kabon kele tani Iba fudu nyama fila membebe ni Kake kele nimfa kele nilani Kele ne korosi kabon kele tani Jani dalaka Jani dalaka Ani oma fila babi fo ye mirila wonema Fudu nyoma ala kane